Hi, welcome to Osun in Progress, the program that affords you first-hand opportunity of getting updates on happenings, events, and achievement of Governor Gboyega Oyetola of Osun State. I am Ademola Amo, your host, assuring you of nothing but an interesting and engaging time out today. On Osun in Progress this week, we shall be taking a look at the health sector with a focus on the revitalization and rehabilitation of 332 primary healthcare centers in Osun State. We shall also be engaging Dr. Adeni Ogini, who is the Executive Secretary, Osun Health Insurance Agency, as he will be taking us through the mandates of his agency and achievements made so far through the Osun Health Insurance Scheme as initiated by Governor Gboyega Oyetola.
Oyetola ń ṣiṣẹ́ kò sí dáwọ́ dúró. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Ìtẹ̀síwájú Ọ̀ṣun ló jẹ wá lógún. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Òkè 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 lẹ́yẹ ń fọ̀hún. Òkè 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 l'Oyetola mú wa lọ. Nípínlẹ̀ Ọ̀ṣun.
You're welcome back, and this is Osun State, and you're on Osun in Progress. It will be recalled that Governor Gboyega Oyetola, during his inaugural speech, promised to revitalize the health sector in line with the agenda of his administration to build healthy citizens. And in fulfillment of this promise to the people, Governor Oyetola, at the inception of his administration, inaugurated a 6-man committee named Osun Special Health Intervention and Revitalization Committee, chaired by the governor himself, with a mandate to review the state of the health sector for efficient and effective healthcare delivery. And according to Governor Gboyega Oyetola, the committee is to embark on quick rehabilitation and revitalization of 332 primary healthcare centers across the state. That is, one per ward, and this is the first of its kind by any state government in Nigeria. It gladdens my heart to tell you that as of today, over 300 of these primary healthcare centers have been fully revitalized and rehabilitated, with all adequately staffed, consumables in full and constant supply, and of course, with reliable power and water supply too. Let's now hear from beneficiaries of the newly revitalized and rehabilitated primary healthcare center in Osun State.
We, the people of Osun State, especially women and mothers, are very happy with our government for our hospitals that have been renovated and equipped with modern medical equipment. May God bless our governor and his team for their dedication and commitments towards the development of the state of Osun.
We want to appreciate our governor, Mr. Governor, in person of Governor Oyetola. We really appreciate him. We thank him a lot since he erected this place for us here. People have been patronizing us very well, and we also want to appreciate him on behalf of all the health workers in Osun State. I want to believe I'm representing them as I'm sitting down here. We thank him a lot because we just heard that he increased our salary, our modulated health salary to 100%. So we really appreciate him, and we pray that all God Almighty will continue to uphold him.
Still in line with the campaign promise of Governor Gboyega Oyetola to deliver affordable, accessible, and quality healthcare service to the good people of Osun State, hence the creation of Osun Health Insurance Agency. And like I did tell you, we shall be having Dr. Adeni Ogini, the Executive Secretary, Osun Health Insurance Agency, taking us through the mandate of his agency and the achievements so far as regards the Osun Health Insurance Scheme as initiated by Governor Gboyega Oyetola. It's a great pleasure having you join us on a
Thank you very much for having me.
Your words to your audience who have been patiently waiting to receive you.
How are you doing all out there? It's my pleasure being here.
Now, let us in on the mandate as regards the establishment of your agency and scope of operation.
Well, the objective of Osun Health Insurance Agency is to pursue the goals of universal health coverage. Universal health coverage means ensuring that every resident of the state gets the healthcare services that they need, anytime they need it, of a quality that is good enough to ensure the desired outcomes, and at a cost that does not cause them any financial embarrassment. That is the purpose of establishing Osun Health Insurance Agency. And the state of Osun, government of the state of Osun is quite passionate about ensuring that every resident of the state gets these services that they need whenever they need it with financial protection. And that is why the agency was established.
Well, rumor has it that this is actually targeted at civil servants only.
Certainly not.
Okay.
We actually have,
Categorization?
We've categorized the population into four.
Okay.
The formal sector, that's where the civil servants are.
All right.
Now the formal sector participants. We also have the informal sector that comprises all of the market women, the self-employed people, the artisans. They are in the informal sector. We have the organized private sector that, brings together all of the people in the, the corporate world, the communication people, the hospitality people, the educational sector. All of these, also formed as a private, but they are organized. So we call them the organized private sector.
Okay.
They are also one group. And then the fourth categorization is the vulnerable population. The vulnerable population consists of all of those people that are the poorest of the poor. The ones that do not have any visible means of, livelihood, and they don't have anyone they depend on. They are more or less vagrants. They are, people that are living with disabilities. All forms of people that cannot provide, money to take care of their own healthcare services. They fall into that group of vulnerability, and there's a program for them under the scheme. So it is not just something that's targeted at the formal sector participants as the civil servants, but it cuts across everyone in the society.
Are there certain ailments that this scheme does not cover?
Oh yeah. There's no social health insurance scheme anywhere in the world that can cover all ailments.
Okay.
But before we determine the benefit package for this scheme, we did a retrospective study. We, looked into the past 10 years into the pattern of diseases that are commonly present in our hospitals, both government hospitals and private hospitals. Now we analyzed them and then we ranked them. And then what we have in our benefit package is 75% of all of those conditions.
Wow.
From the first to the 75th percentile. So you discover that it is almost impossible. It's just one out of how many cases? If you have 100 conditions,
okay,
you only have 25 that are not covered under the health insurance scheme. The benefit package covers all of the things like malaria fever, typhoid fever, gastroenteritis, operations when you have acute appendicitis. It covers appendectomy, it covers herniorrhaphies, it covers cesarean section. Most of the things that commonly present or that commonly affect people are covered under the benefit package of Osun Health Insurance Scheme.
Now, talking about taking off burdens, this must be a very huge task. Let us in on the government's involvement as far as this scheme is concerned.
Government, particularly the government of Mr. Gboyega Oyetola, has done a lot, quite a lot in ensuring that this scheme is not only established, but that it is successful and that it is sustainable. Now, beginning from the inaugural speech of Mr. Governor, Mr. Governor said he would provide healthcare services of a good quality to the residents of this state through the instrument of the state social health insurance scheme. And as soon as he got into office, from the first month, he started asking what are the things that he needs to do to ensure that we establish one of the best, if not the best, health insurance scheme in Nigeria. And we told him all of the parameters that we need to achieve to be able to, establish a scheme. And he started beginning from the release of the enabling circulars for the civil servants' contributions. He gave us the circular, inclusion of the health insurance scheme in the budget. That's one of the factors that must be, achieved before.
In the budget?
In the budget, yes. Of course, the health insurance scheme was placed in the budget. Aside from that, he released, equity grant that was meant to take care of the vulnerable, the state component of the equity grant. Wow. He released. Aside from that, he also put in a board. He inaugurated the board. Then aside from that, from time to time, he would ask us, what are the challenges that you are having? And, one of those areas I would like to, let everybody know that has put us ahead of all other schemes in the country is when we were having challenges, with our enrollees, with our healthcare providers. Enrollees will take the OAS card to the healthcare provider, facilities, and they will deny them drugs. They will tell them, oh, this one, OAS doesn't cover this, OAS doesn't cover that. Immediately we wrote to Mr. Governor. Mr. Governor gave approval for us to establish our drug distribution center. Is the first of its kind amongst all state health insurance schemes in this country as of today. And last week we were in Abuja. The National Health Insurance Scheme is already talking about, drug supply implementation team, because they have seen the kind of things that's going on. Even though the program was in the pipeline at the NHIS level, but no state has started it. We are the first state that started it. And by that intervention of Mr. Governor, every facility that is accredited by OAS, all the government facilities, they will have 17 of them.
17?
17 of them providing both primary and secondary services. All of those facilities come to the OAS Drug Distribution Center. At the beginning of the month, they collect drug from the facility, from the drug distribution center, so that anytime any enrollee of OAS gets to the hospital, the government hospital, there is drug. The issue of OS doesn't, out of stock does not arise. So the people get the drug from government, hospitals, as is contained in the essential medicine list of Osun.
So in total now, how many do we have when you sum up the government facilities and the private?
Oh, we have 86 altogether.
86?
86 facilities. And I must tell you something. Those private facilities, initially, when we were starting last year, some of them were reluctant. They didn't want to come on board and everything. But as at September, when we paid the capitation, they were dancing. And yesterday we had, our providers forum. You could see, the excitement and the enthusiasm of those care providers. They want to give the best because they are seeing that this thing is working. Many other facilities have been, collecting application forms to,
showing
come
interest.
on board. They are showing interest. They want to come on board now. But we are going to regulate definitely. We're not going to bring everybody at the same time. We'll wait for, the number to increase. Okay. The more the number of enrollees increase, the more we're on board, other facilities, so that, it can be spread across all local governments of the state, and then every other person, benefits from the scheme.
My good people of Osun, my name is Isiaq Adegboyetola. Today, Osun has become a reference point globally. I shall not fail to mention the resilience and sacrifice of an courageous civil servant, pensioners and artisans who stood solidly by us. My people, I'm confident that Osun will be the best place to be if we collectively join hands together to move our state forward.
You're welcome back, and this is Osun State, and you're on Osun in Progress. Other notable achievements, precise ones.
Our achievement is that the enrollee list, is increasing. We are, having, more, opportunity to give healthcare to the people. Like I told you about the vulnerable person that had to be operated. This patient would have died, if there was no health insurance.
So what actually happened to that particular person?
No, the house was burning. And this patient had come out of the house, the burning house, but he remembered that, oh, we have 1,000. She had 1,000 naira in the house.
1,000 naira?
She ran into the burning house to salvage 1,000 naira.
Wow.
And she got burnt. Both hands were badly burnt. She suffered third-degree burns, and then she had to be amputated. They did the bilateral below elbow amputation, and she didn't have to pay a kobo because we registered her under the vulnerable program of the Osun Health Insurance Scheme. And for the whole period she was in the hospital, feeding, accommodation, treatment, everything, operation free of charge.
Hold on, sir.
Yeah.
Before this incident happened to her, she wasn't part of the scheme.
No. The scheme is just a new scheme. We started providing services in November last year. And as at the time it happened, she was not a member of the scheme. She wasn't enrolled as a vulnerable.
So the government took it upon itself.
Oh, the government had already paid money to care for vulnerable persons, like I told you. And so from the money that government has paid, such people, there are other people. There was a time Mr. Governor was, going in his convoy and they saw a vagrant, somebody, along the street, and I guess he think he was, maybe the guy was not well. They took him to the mental center in State Hospital at Shubia Road. He had nobody. Immediately they notified the, Osun Health Insurance Agency. We went there. There was nobody to take care. We enrolled that person under the vulnerable scheme and they started receiving treatment. Now, this is how good it is. So once we are able to determine someone's vulnerability, the person automatically comes on the vulnerable program of the health insurance and is taking treatment free of charge. There are many sickle cellers that are on our scheme. Sickle cell patients that don't have anybody to take care of them, they are on the scheme as vulnerables. They go to the hospital to receive treatment. They don't even have to pay the 10% of co-payment on drugs because others will pay 10% co-payment on drugs. But for the vulnerable people, not payment of any kobo. They get there and they receive treatment. And we treat them, what they will give to them is what they will give to me if I go to the hospital.
No hidden charges?
No hidden charges whatsoever. If any hospital does any hidden charge, there will be penalties, there will be fines, there will be sanctions. Yeah, it's also good for me to add that as part of the achievements of the government of Mr. Adegboyega Oyetola, when I was talking about the vulnerable population, the vulnerable populations are empaneled to primary health centers that are closest to them where they live, except when the conditions are, not manageable at the level of primary health center. That's when they go to the, secondary health center or when they go to a teaching hospital. Now, in order to be to ensure that these, facilities provide the services that are required under the scheme, the governor undertook the revitalization and rehabilitation of 332 primary health centers at the rate of 1 per ward in the state. And they are receiving the treatment in those facilities. Now, aside from those primary health centers that are being rehabilitated and revitalized by Mr. Governor, at the secondary level, one of the greatest achievements to enrollees in the state is that many people who are built to have cesarean section. Many of the women who have had maybe 1 previous CS, 2 previous CSs, and of course, if you are coming for CS in this state, in the private sector, it's about 150,000, 180,000. If it's the government, you will pay the materials and everything, you will be ending up maybe 70,000 or something. But right now, under the scheme, once they are enrolled, we ensure that a pregnant woman does a family enrollment to increase, of course, to share the risk. So once you're a pregnant woman and you register as a family, yourself, your spouse, and the children, for 57,600 naira, you have access to cesarean section and everything. I want to tell you that as I speak, we have had over 24 cesarean sections on, aside from other operations. We have had over 24 cesarean sections. I mean, some of them, when they tell them you are going to pay 7,000, they wonder, for what? Just 7,000? And for all of this, they have wonderful testimonies, to tell about the scheme. So many of them would not have been able to access care if it was not for the scheme. But for many of them now, there is joy in the family because cesarean section is done at a cost that does not cause any financial embarrassment to the family, and everybody in the family is happy. This is also part of the achievements that we have had on the part of the enrollees. It has brought smiles to the many families who would have become impoverished looking for the 150, 180 or 20,000 naira to pay for cesarean section. But they come smiling to the hospital with their cards. And all of this is taken care of under the scheme. Thanks to Mr. Governor, of course, who made it possible for us to be able to work.
Wow, I can hear people saying thanks to Governor Gboyega Oyetola as well. And as you did hear it from him, that should any facility request for any hidden charge, there is and there will always be penalty.
Yes,
now, any final word to the people of Osun State?
My final word to the people of Osun State is that the government of this state under Mr. Adegboyega Oyetola has created an enabling environment for every resident of the state to access care. Not just care, but care of high quality. And not just that, at a cost that is affordable to everyone. So let everyone take advantage of this enabling environment that Mr. Governor has created in the health sector. Let everyone go to Osun Health Insurance Agency and register. Pay your 12,066 if you are, in the informal sector. If you want a family package, pay 57,600 naira. And your health is guaranteed for the entire year. It is a scheme that is functioning. Everybody knows it's already functioning. And every resident of the state should take advantage of it. Don't cheat yourself. Be part of OIS. And you'll never regret you did. That's my parting words to the people.
I'll be part of OIS and you will never regret it. Once again, thank you so much, Dr. Adeni Ogini. He is the Executive Secretary, Osun Health Insurance Agency. Thank you so much for your time.
Thank
All
you.
right, we'll take a break now. When we return, more still awaits on Osun in Progress.
Ẹ jẹ́ ká lọ sípínlẹ̀ Ọ̀ṣun. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Ẹ bá mi ká lọ sípínlẹ̀ Ọ̀ṣun. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Oyètọ́lá ń ṣiṣẹ́ kò sì dáwọ́ dúró. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Ìtẹ̀síwájú Ọ̀ṣun ló jẹ wá lógún. Bẹ́ẹ̀bẹ́ ò dúró, bẹ́ẹ̀bẹ́ ń lọ. Òkè 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 lẹ́yẹ ń fọ̀hún. Òkè 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 l'Óyètọ́lá mú wa lọ. Nípínlẹ̀ Ọ̀ṣun. Òkè 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 lẹ́yẹ ń fọ̀hún. Òkè 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 l'Óyètọ́lá mú wa lọ.
And that's a package for this week on Osun in Progress. But before we go, a quick recap of our focus for today. We took a look at the health sector with special interest in the revitalization and rehabilitation of 322 primary healthcare centers in Osun State. That's on one hand. And on the other, we had an interaction with Dr. Adeni Ogini, the Executive Secretary, Osun Health Insurance Agency, where he took us through the mandates and achievements of his agency, as initiated by Governor Gboyega Oyetola. With this, we can confidently say that Oyetola is working and Osun is progressing. On behalf of my coordinator, Funke Egbemode, Commissioner for Information and Civic Orientation, my producer, Muyiwa Adejumo, I am Ademola Amo, saying thank you for watching. See you next week.